Hi YouTube, it's Courtney. I'm coming to you with a month 3 plastic surgery update, and I'm also 19 months out post-op vertical sleeve gastrectomy. I had my plastic surgery with Dr. Richard Reish at Long Island Plastic Surgery Group. I had a tummy tuck, breast lift, and liposuction. I've been dealing with seroma. I had a drain taken out a week ago on Tuesday, and then all hell broke loose with the election with me and work. And then I was in DC for a trip, and when I got back, my doctor texted me and asked how I was doing, and I was like, I think this Seroma's back. So he texted me yesterday and asked me if I could come in today because he happened to have office hours today. And I went in and I saw him and we talked about it, and he said yes, the Seroma was definitely back, and I had a few options, but he thought that the best option was to surgically remove the Seroma. So today I had a surprise surgery. Some surgeons do the Seroma extraction under general anesthesia, including my surgeon, but it can be done under local anesthesia in office, and that is what we opted to do today. So he numbed me up with a lot of lidocaine, and I have like a 4 or 5 inch incision along my tummy tuck incision, and he literally opened me up while I was in the office and scraped out the seroma with a cauterizer, which sounds like exactly what you think it sounds like. And so I laid there while my body smoked, which was a new experience. Sorry, the cat is driving me absolutely insane. This is the second time I started this video. And he looked at the seroma and he said that the seroma was an extremely smooth capsule, which made it very, very hard, if not impossible, for it to adhere to my abdomen wall, and that no matter what, I was probably going to end up in the situation that I'm in now. So he created a rough surface so that it could adhere to itself, and drained me out and removed the seroma capsule, and then he sutured my abdomen wall to the fascia and muscle to keep it flat and keep the space from this is my life, everybody. This is my life. Fucking cat. So it's been a really weird day. So he sutured the abdomen wall to my fascia and muscle. I think it was my muscle too. And then he closed me back up. It took about an hour and a half from the start of him putting like the 40 shots of lidocaine into my stomach to closing me back up. Honestly, the weirdest thing about the entire thing was when he was listening to string quartet covers and Welcome to the Jungle came on while he was suturing me up, and it is funny, and it is as funny as you think it is. I tried not laughing during it. If I could tell Siri to change it, I would have, but I couldn't, so. It didn't hurt. It was uncomfortable sometimes. There was a lot of pressure, and every once in a while it stung. I did feel him cauterizing me once, but the minute I yelped, and he stopped and he put more lidocaine on, and anytime I had any discomfort at all, he just gave me more lidocaine, and it wasn't really bad. Now, he did say that he won't do this with every patient because he's seen me go through several procedures at this point, and he thinks my pain tolerance is extremely high. He felt comfortable doing it under local anesthesia, but that's not necessarily the case for everybody, so it's completely at the discretion of him on what he would do. But he didn't feel like it was worth putting me under general anesthesia. For that, I'm grateful, because that would have been worse for me, totally, to be completely honest. So he did insert a drain again just to make sure that everything's out and any fluid that does accumulate gets removed. So this is my third time having a drain in since surgery. He said not to worry about fluid accumulation, that it's normal and it's fine. And then, really, you want to say hi? Freaking cat. And that he will take the drain out the Tuesday after Thanksgiving, so I'm with the drain for a little over a week and a half again. And an annoying cat. So he said that he's 100% sure that this will work this time. I don't know who can give 100% assurance, but I'll go with 95%. He was great. Everything was fine. Everybody in the office was wonderful. They prescribed me antibiotics, Percocet, and Valium for good measure, of which I have taken all 3 and will probably pass out soon. The pain is bad right now. The lidocaine is wearing off, and it feels like he did exactly what he did, and also like I've had the shit kicked out of me. So, but I mean, other than that, my tummy tuck looks great and my breast lift looks wonderful, and this could have happened to anybody, and it's not a reflection on him as a surgeon. So I just want to make that very, very clear that it could happen to anybody. He did say that it's only happened to his patients with extreme weight loss. So, I mean, it makes sense. If you know the physiological reasons for seroma, it makes perfect sense. So, I just want to give a little update on that. I'm doing okay. I'm tired. It was a really long week. This is my first day off since the election, and I'm really exhausted. I haven't been eating well. I've been eating a lot of carbs. There's been a lot of feelings eating. As just trying to get through the next however long. It is what it is. So, I hope everybody's doing well. And I don't really have much more to update on. My weight is like up and down like a roller coaster right now because I'm eating like crap, and also because I have my period today, because I had insult to injury with that one. But then also because the swelling is just astronomical. But in terms of weight loss surgery, it was really great. I went to DC and was able to walk around with no problems after working a conference for 2 days, and I did it in flats. It wasn't a problem. It was like 7 miles almost that we walked, and everything was great. I felt fine, and other than just being like mentally exhausted, it was lovely to walk around the Air and Space Museum, and we went to the Botanical Garden, and we went over to the archives, and we saw the Constitution and the Bill of Rights, and Declaration of Independence, and saw like a corner of the White House, walked up to the Washington Monument, and if you know the mall, then you know from this, like I walked like 3/4 of the way around the National Mall. And then we got home really late, and I've had to work the rest of the week, so thankfully this is a short week for me. I may be taking off the rest of the week until Thanksgiving, through Thanksgiving, so that I can heal and recover and not think about it, but I'm not sure. I was planning on taking off the week between Thanksgiving and Christmas and New Year's, but whatever. So I'll keep you guys updated on whether or not this gets worse or better or whatever, how I'm feeling, how the recovery is on this. I'm really, really uncomfortable right now. I've moved back into our second bedroom again for the third time. It sucks. So, okay, well, I'm gonna say goodbye to Boo Boo. Boo Boo. Hey, Boo Boo. What you doing? Say goodbye. This cat, she'll be by my side for the next 3 days. So, okay. everybody have a lovely night, and to all my US friends, happy Thanksgiving if I don't make a message or video before then, but I probably will. And I will be in touch soon. Bye.